Welcome, and thank you for joining us. Out of an abundance of caution, we've made the difficult decision to host this ceremony virtually. But we didn't want to delay honoring these two chairholders in front of their family, peers, and all of the generous supporters joining us today. Investitures are a special opportunity to celebrate career achievements and Arkansas children's robust culture of philanthropy. Today, we celebrate two physicians, Dr. Eudice Fontenot as the recipient of the Betty A. Lowe, MD, Distinguished Chair in Pediatric Education, and Dr. Michael Schmitz as the recipient of the newly established Lowe for Kids of Arkansas Endowed Chair in Congenital Heart Disorders. These two exceptional physicians have been a part of the team at Arkansas Children's for more than 2 decades. And we celebrate the donors who funded these two chairs, Dr. Betty A. Lowe and family and friends, and Lowe of Kids of Arkansas. They are the embodiment of true champions for children. Dr. Lowe was a distinguished physician at Arkansas Children's Hospital for almost 4 decades and was, as many of you know, a nationally renowned educator and a passionate advocate for child health. And Lowe for Kids of Arkansas has raised more than $10 million for the children of Arkansas, and these dedicated volunteers lead the nation in raising funds to support child health. Marcy will share a bit more about these two generous donors in just a moment, but I do want to say how personally moved I am by the tremendous impact they've made on our patients and families, and I am grateful that we can honor their legacy in perpetuity. Endowed chairs are a critical element of a pediatric teaching hospital, and they allow the team to competitively recruit and retain top talent from across the country. This is the kind of transformational philanthropy that fuels our mission. And because of the support we've received from many of you joining this celebration today, Arkansas Children's and the children of Arkansas benefit from 40 endowed chairs and 322 individually endowed funds. And now, I'd like to introduce Dr. Cam Patterson, Chancellor for the University of Arkansas for Medical Sciences.
Thank you, Fred, and thank you to the family of Dr. Lowe and the many Lowe for Kids of Arkansas volunteers joining us today. It's my distinct honor to be with you as we induct Dr. Eudice Fontenot as the recipient of the Betty A. Lowe, MD, Distinguished Chair in Pediatric Education, and Dr. Michael Schmitz as the recipient of the Lowe for Kids of Arkansas Endowed Chair in Congenital Heart Disorders.
Thank you, Dr. Patterson. I'm honored to be here today to celebrate Dr. Fontenot and Dr. Schmitz. Both of these outstanding physicians have been recognized by their peers as the best in their fields and named to the prestigious Best Doctors in America list several times. Dr. Fontenot for cardiology and Dr. Schmitz for pediatric anesthesiology and pain management. I'd like to first celebrate the legacy of Dr. Betty Lowe, who made this chair possible. To do so, her sister Margaret is with us to share a few words.
Thank you, Marcy. I am pleased to be here today to represent the Lowe family and to express our thanks to the friends and colleagues and the ACH Foundation staff who made this recognition of Betty possible by their generosity in the funding of a distinguished chair in pediatric education. We were successful in keeping Betty out of the loop as we were fundraising, since she was not interested in self-recognition in any form. Some of you may not remember that the first position Betty held at ACH was Director of Medical Education, preceding her appointment as Medical Director. She believed that education could and should take place in many venues other than the classroom. Although the designation of the Betty Lowe classroom here at ACH was fitting in that she had struggled for years with each revision to the physical structure of ACH to find dedicated space for a classroom for all pediatric and healthcare teams. Betty's niece, Gina, an ICU nurse, related to me an example of her taking advantage of the moment. While on bedside rounds in the PICU, Dr. Lowe noted the nurse was struggling with the procedure. She immediately whipped her pen from her coat and drew an anatomy diagram on the patient's bed sheet. and said, "There, that should help." Medical students, interns, and residents would tell you that she did not believe in the status quo nor the notion we have always done it this way. Recognized as a great diagnostician and consummate teacher, Dr. Lowe had the unique ability to effectively educate, no matter the background of her students or patients. Another of her talents was being a good listener. She used that skill to be a better doctor and in her patient interaction. It was not unusual to see her kneeling on the floor at eye level with a young patient asking her a question. She listened intently before responding with her answer, making patient and family feel special and that they were the only thing on her mind at the moment. Her sincere and down-to-earth manner of teaching did not go unnoticed by all who knew her. She wanted to ensure that future pediatricians and other healthcare professionals participating in the care of children would always be up to date in knowledge, technology, education, and cultural effects on medical care. In developing the library at ACH, she insisted that there might be space and resources for educating families and children, as well as medical and healthcare professionals. The vision for this chair was to provide resources to attract a physician scholar who values education for the development of new regimens for maximizing pediatric care in the ever-evolving health, medical, technological, and social support systems of today and tomorrow. Areas of interest would include, but would not be limited to, educational projects of national significance with potential for replication in other pediatric care venues, research to enhance pediatric care and teaching through a multidisciplinary approach, and utilization of new technology in teaching and practice. Someone who demonstrated the ability to accept the challenge of developing innovative ways of delivering patient care and education, utilizing a team approach to provide leadership, assistance, and direction by publishing and sharing education and research activities with other professionals and centers specializing in patient care. It is with pleasure that the family and friends of Dr. Lowe recognize Dr. Eudice Fontenot as the right person for this prestigious designation, a recipient and steward of the Betty Lowe, M.D., Distinguished Chair in Pediatric Education. Dr. Fontenot, we look forward to your continued success in educating families, students, physicians, and pediatric healthcare professionals through improved patient care.
Thank you, Margaret. Arkansas Children's Hospital would certainly not be the institution it is today without your sister's guidance, grace, and leadership. Dr. Lowe was the first Arkansan to become a pediatric rheumatologist, and in 1993, she became the first Arkansan and only the second woman in the nation's history to be named president of the American Academy of Pediatrics. All this, and Dr. Lowe also had a deep reverence for education when it came to training the best and brightest pediatricians. Dr. Lowe's legacy will be forever a part of Arkansas Children's Hospital, and I believe she would be thrilled to see Dr. Fontenot taking the reins as chairholder, giving the pediatricians of tomorrow the opportunity to learn under his leadership and guidance. As the Vice Chair of Education in the Department of Pediatrics at UAMS, Dr. Fontenot accepted the challenge 16 years ago to develop and direct Pediatric Cardiology Fellowship Program, and his leadership and strategic vision have ensured our program provides outstanding clinical training. And because of extraordinarily talented cardiologists like him, Arkansas Children's has been named one of the best children's hospitals for cardiology and heart surgery by the U.S. News and World Report for the past 4 years in a row. Our nationally ranked heart center sees close to 8,600 patients per year, reads close to 1,500 echocardiograms each month, and has performed more than 340 heart transplants. We currently follow more than 1,100 congenital heart disease patients. Simply put, physicians like Dr. Fontenot are improving outcomes for children battling heart disease. Dr. Fontenot, thank you for the important work you and your team do every day for our patients, including this young lady, Kelly. Kelly has a rare genetic connective tissue disorder called Ehlers-Danlos syndrome. This creates other complications that cause her autonomic nervous system to not function as it should. As a part of the team leading care for Kelly, it's clear Dr. Fontenot has made a tremendous impact on her life. At just 16 years old, Kelly uses her voice to advocate for patients like her who are managing a genetic disease. She even wants to be a nurse practitioner. On behalf of all of our patients, thank you, Dr. Fontenot, for being a champion for children like Kelly. Having physicians like you on the team is truly advancing our promise: unprecedented child health, defined and delivered. I would like to now introduce Dr. Joseph Bucchini, Professor and Vice Chairman of the Department of Pediatrics at Tulane University and Director of Children's Health Services at the Willis-Knighton Health System in Shreveport, Louisiana.
Hi, everybody. I'm pleased today and honored to participate as a speaker in this investiture ceremony for Eudice Fontenot as the Betty Ann Lowe, MD, Distinguished Chair in Pediatric Education. I've been a fan of Dr. Fontenot since he was a resident at Louisiana State University Health Sciences Center in Shreveport, and I followed with pleasure his successful career as a physician, educator, and academic leader. This honor in Dr. Lowe's name also has a special meaning for me because I arrived in Shreveport in 1997, and I've been able to witness the emergence of Arkansas Children's as one of the leading children's hospitals and training programs in the country. I had the opportunity to meet and speak with Dr. Lowe on several occasions during her tenure as medical director of Arkansas Children's. I also know of her from the many stories I've been told by the LSU Shreveport Medical School graduates who trained there. Dr. Lowe is clearly the catalyst for Arkansas Children's transition to a center of national prominence. But what she is best known for by her former residents are for her clinical and teaching skills, her practical common sense approach to patient care, her frequent pearls of wisdom, and her commitment to resident education as a ward attending and a faculty member at innumerable morning reports. These all earned her the respect of all of her residents. When I think of these attributes, it's clear to me that they also describe Eudice Fontenot. Eudice has a passion for teaching and for making things better for children, and he has a supportive approach to educating at the bedside and has a gentle approach to making a resident aware of how he or she could have done better for a patient. 21 years ago, he found the ideal setting for his talents, UAMS and Arkansas Children's. During his tenure, he has cared for the sickest post-op surgical CV patients as the medical director of the cardiovascular ICU, and he has educated a generation of students and residents. Paul Seib, cardiology section chief, said something that I think defines his contributions and the evolving role Eudice has played in the development of Arkansas Children's cardiology and cardiac surgery programs. He said that Eudice is from the era of the quote-unquote do-all cardiologist, what I would call the generalist pediatric cardiologist. His broad expertise and his skills have enabled him to have a hand in the development of each of today's pediatric cardiology subspecialties and to develop and supervise a successful cardiology fellowship program. As a trusted senior faculty member, he is frequently called upon for his wisdom and counsel as important decisions need to be made in the section. He is known for his dedication, hard work, and excellence in teaching. In fact, the Cardiology Section Teaching Award is named after him. Eudice led the establishment of the Cardiology Outreach Clinic in Northwest Arkansas and traveled by plane to see patients there weekly for years. I'm told that he may have even co-piloted some of the flights, but if that's not legal, I didn't say that. I would be remiss if I did not mention his lovely wife, Tessa. Tessa has been a strong partner and supporter of Eudice and a partner to his successes, as well as he of hers. They make a remarkable team. Like Dr. Lowe, Eudice is well respected and has a positive can-do approach to problem solving. He demonstrates these attributes in every aspect of his work. He's a wonderful role model. Eudice has even taken his place at Arkansas Children's Morning Report for general peds as well as cardiology. Eudice clearly has demonstrated the excellence in educational pursuits in both clinical and academic teaching required by the criteria for the holder of the Betty A. Lowe, MD, Distinguished Chair in Pediatric Education. He's contributed for more than 2 decades to the continued growth and recognition of Arkansas children, so well begun by Dr. Lowe, by his accomplishments as a clinician, educator, and academic faculty leader. And he's not done yet. I am honored to be a part of the investiture of Dr. Fontenot as the 4th holder of this chair. Well done, Eudice. My heartfelt congratulations. Thank you.
Thank you, Dr. Bocchini. It's an honor to have you with us today to celebrate Dr. Fontenot. Dr. Fontenot, your selection to become the recipient of this prestigious endowed chair is a testimony to the high regard with which you are held by your colleagues and your friends. The future of pediatrics belongs to leaders like you. For this, I want to thank you and congratulate you. By the authority vested in me by the Board of Directors of Arkansas Children's Hospital, we are pleased to invest Dr. Eudice Fontenot into the Betty A. Lowe, MD, Distinguished Chair in Pediatric Education. Congratulations, Dr. Fontenot.
Thank you, Dr. Bocchini, for your kind remarks. To the Lowe family, Beverly Morrow and the ACH Board of Directors, Fred Scarborough and the ACH Foundation, colleagues, friends, and family. I'm not sure I have the words to describe my emotions when I heard about this award. I was humbled, grateful, amazed, excited, overwhelmed, a bit intimidated. Did I say humbled? To be named the next holder of the Betty A. Lowe, MD, Distinguished Chair in Pediatric Education. As someone who chose academic pediatric cardiology as a career, next to becoming a full professor, receiving an endowed chair represents a culmination of all things academic. I had the distinct pleasure of knowing Dr. Lowe and working with her in her capacity as the Chief Medical Officer at Arkansas Children's Hospital during my tenure as Medical Director of the Cardiovascular ICU. We worked closely together during a cardiac surgical transition and recruitment time. I acted as her informant and was frequently called to the principal's office for a chat. I distinctly remember seeing her office number appear on my pager and thinking, uh-oh, what have I done this time? Betty always provided guidance and words of wisdom from her years of experience and was always available to answer my questions. We remained friends until her departure. To me, the Lowe Chair is a lasting tribute to Betty's character, medical prowess, leadership, and commitment to all things pediatric in this state and beyond. Betty was a staunch advocate for children's health care, an effort that extended to an international audience, evidenced by her being named the president of the American Academy of Pediatrics. As medical director for Arkansas Children's Hospital, Betty oversaw a huge growth in the hospital and the pediatric services provided to ACH. Dr. Lowe was also very involved in pediatric education at all levels, medical students, residents, and fellows. Her presence and remarks at Resident Morning Report, along with Dr. Pfizer, are legendary. The funds generated by this generous endowment allow the chair holder to remove financial barriers to new ideas and innovations in pediatric education. The chair funds also provide a milieu in which junior faculty are encouraged to bring their ideas forward for funding consideration. Examples of this include helping Dr. Jared Beavers, a junior faculty in pediatrics, to realize his desire to develop and deploy a digital learning platform in pediatrics that houses an incredible amount of educational activity. This new platform, named JEDI, Jones Educational Institute, based on the Canvas learning system, is a new platform which now is available to all faculty and house staff through licenses purchased with the Lowe Chair funds. This can be accessed by all learners and faculty at any time, 24/7 on any device. This platform houses things like schedules, lectures, videos of procedures, and quizzes, just to name a few. The platform is uniquely malleable to do almost anything imaginable. We are just learning the capabilities and applications for this platform as a tool to educate pediatric learners. Another recent example of how the funds are being used to further education is the recent purchase of QStream Access. This is a scientifically studied micro-learning platform used by industry to promote knowledge retention. This is being used by the senior residents as a study tool in preparation for pediatric board certification exams. The chair funds are also used to celebrate academic accomplishments by rewarding the work of our pediatric fellows during their annual Fellows Day festivities. To provide a scope of the pediatric educational activities currently happening on this campus, every year there are 175 third-year medical students rotating on pediatrics at ACH. There are 93 pediatric residents based here. There are 51 fellows here in pediatrics, surgery, anesthesia, and psychology. This easily places Arkansas Children's in the top 10 of pediatric academic medical centers in the United States. Currently, there are 3 new fellowships undergoing the approval process, and a 4th is being developed as we speak. The recent pandemic has affected us all in ways no one could have predicted. This virtual investiture ceremony is an example. As you might imagine, the restricted in-person meetings, masking, and social distancing drastically affected how we deliver pediatric education to our learners. Like others, we adapted and evolved to a new norm in how we do education. The recently funded digital platforms are a reflection of how we are adapting. The funds provided by the Lowe Chair put the chair holder in a unique position to help expand the boundaries of not only doing the day-to-day educational activities we and academics get to do, but also help foster exciting new and fresh ideas in education as we adapt to the new normal. I'm looking forward to the opportunity to use these funds in memory of Betty in a way that honors her drive and her mission of taking care of the whole child and advancing pediatric care in Arkansas and beyond our borders. Thank you to everyone who has helped make this dream a reality for me.
Congratulations again, Dr. Fontenot. As we begin to celebrate the great work of Dr. Michael Schmitz, I'd like to first recognize a very special group of people. We wouldn't be here today without the heartfelt initiative of a dedicated group of volunteers. For more than 25 years, Lowe for Kids of Arkansas has supported Arkansas Children's through golf and fishing tournaments, catfish dinners and auctions, and of course, loads of logs. They have been a valuable partner through our Children's Miracle Network Hospitals partnership, and together their fundraising efforts have put a national spotlight on Arkansas. In addition to this endowed chair, they've funded 2 others, one in pediatric cardiovascular surgery, currently held by Dr. Brian Reamson, and one in emergency medicine and trauma, currently held by Dr. Lawrence Quang. They've also funded endowments for our Angel One transport team and our pediatric imaging program. Their work is certainly something to be proud of. To those of you joining us, thank you. We are grateful for dedicated champions like you who make special moments like today possible. Having an endowed chair in congenital cardiac disorders allows Arkansas Children's to transform health for children with congenital heart disease. And we are grateful to have had Dr. Schmitz as a part of our team for nearly 30 years. As the Chief of Pediatric Cardiothoracic Anesthesiology and Vice Chief of Pediatric Cardiothoracic Surgery, Anesthesiology, and Pain Medicine, Dr. Schmitz has continuously demonstrated his commitment to providing excellent and compassionate care for our patients and their families. He is a true thought leader and dedicated educator. He has been recognized by the UAMS Senior Medical Class twice with the Red Sash Award, an award bestowed upon the faculty members they deem to be the most excellent teachers. He serves as Professor of Anesthesiology and Pediatrics and Assistant Professor of Surgery at UAMS and has published a number of peer-reviewed journal articles, close to 70 if we're counting. He has also served as the principal investigator for over 20 research grants and as co- or sub-investigator for more than 10 others. His most recent research interests have been focused on the safety of an antibiotic used to prevent surgical infection in children and studying the pharmacokinetics of opioid administration in patients with post-operative pain. He's also studied the effects of anesthetic agents and surgery on the brain development of patients undergoing cardiac surgery. Additionally, Dr. Schmitz serves on several internal committees at Arkansas Children's and UAMS to further patient care and uphold best practices. Dr. Schmitz, thank you for the important work you and your team do every day for our patients, including this young man, Jace. At birth, Jace was born with not 1, but 3 congenital heart defects. Because of Dr. Schmitz and the entire cardiology team at Arkansas Children's, Jace had an access to the expert care he needed to survive. Now a thriving 9-year-old, Jace has been an ambassador for Arkansas Children since 2017. On behalf of all of our patients, thank you, Dr. Schmitz, for being a champion for children like Jace, making them better today and healthier tomorrow. It's an honor to recognize you as the new chairholder of the Lowe for Kids of Arkansas Endowed Chair in Congenital Heart Disorders. I know you will continue to do extraordinary things to advance the care for our patients. I would like now to introduce Dr. Robert Jaquist, Division Director of Pediatric Congenital Cardiothoracic Surgery and Co-Director of the Heart Center at Children's Health in Dallas. And Dr. Jaquist is no stranger to Arkansas Children's. He served as our Chief of Pediatric Cardiac Surgery from 2005 to 2010.
Thank you, Marcy, and good afternoon to all the folks who are attending this investiture ceremony this afternoon. And I can't tell you how thrilled I am to be able to say a few words about my friend, your friend, Dr. Michael Schmitz. I've got a slide here that describes some, but probably not all of Mike's many titles, particularly including the Lowe Chair in Congenital Cardiac Disorders. I can't think of a more deserving recipient. And I am so grateful, as we all are, to the Lowe folks who have been great supporters of ACH. You do wonderful things, and thank you. So as you'll see from this next slide, the theme this afternoon is going to be in keeping with what I just said, which is gratitude. So what you see now is a picture that I think all of you will recognize who have driven outside central Little Rock, which is a deer in the headlights. And when I arrived at Arkansas Children's Hospital in 2005, that's a little bit what I felt like. This next assemblage is the 3 pediatric cardiothoracic surgical attendings, ranked in not order of importance, perhaps, maybe in order of height. So Dr. Imamura, myself, and then in the background, smiling as he always does, taller than everybody around him as he always is, and a rock of strength was Mike Schmitz. And I can't tell you how grateful I am to Mike for the support and guidance and mentorship and friendship that he provided to me, not just in that first month that I was in Little Rock, but for all the time that I was there and subsequently. The next picture is the rest of the team, and then the picture sort of expanded and it began to degenerate a little bit. But Mike kind of set the tone for the group. We were serious when we needed to be serious. We were focused and committed to the mission of ACH, but also kind of decompressing what can be a very pressurized situation. Moving on to beyond personal gratitude, I'd like to also offer the thanks of a grateful Texas to Mike. Among his many other gifts, he is an incredibly talented educator and mentor. And in the state where I now practice, there are, beyond myself, at least 3 other people who have assumed positions of leadership, armed with the skills and the preparation and the advice of Mike. I want to also say that just as Texas thanks Arkansas, I want to remind Dr. Schmitz, and I'm sure he doesn't need to be reminded of this, that he has something to thank Texas for, so the arrow of gratitude can be reversed and go in the other direction. And you will know as soon as you see the next slide what I'm speaking about. I'm speaking, of course, about the real Dr. Schmitz, Susan Schmitz, who is a native of Austin and was poached by Mike from this great state, I think, having met together in pediatric residency in Los Angeles. But on a personal note, again, I want to say that Dr. Schmitz was a pediatrician for my 3 ungrateful little children when they were small and needed pediatricians. And my wife absolutely has said to me innumerable times that the real Dr. Schmitz was the best pediatrician we ever had. And then finally, a few words about Arkansas Children's Hospital, the great organization that I was privileged to be a part of for several years. I know that Arkansas Children's Hospital is and should be very grateful to Mike. And to use a sort of an analogy or a construct that Mike, as a brilliant man, will understand, there was, in mathematical terms, a parade of variables on the surgical front to culminate in the two terrific surgeons and the wonderful surgical program you have now with Dr. Reamson and Dr. Greiton. So I would describe that as a parade of variables. But during that entire time, there has been one single constant. And as you can see here, 29 years and counting, Dr. Mike Schmitz, a pillar of strength, of continuity, of good Midwestern sense translated into an Arkansas location, a brilliant clinician, a wonderful teacher, above all, a great human being with a great sense of humor. I would say, comparing these two pictures, that for 29 years, the years have been pretty kind to Mike. So in conclusion, I'd like to offer a toast to Mike Schmitz. He is certainly in the top 5 smartest people I've ever met. I won't embarrass the others, and I won't embarrass Mike by saying where he is in the top 5, but he is absolutely in the top 5. And he is certainly the best cardiac anesthesiologist I'll ever work with. Mike, on behalf of everyone here and all who have known you and benefited from that knowledge and friendship, thank you for everything.
Thank you, Dr. Jaquist. We are thrilled you could join us today to celebrate Dr. Schmitz. Dr. Schmitz, your selection to become the recipient of this prestigious endowed chair is a testimony to the high regard with which you are held by your colleagues and your friends. Our future is in great hands with doctors like you. Thank you and congratulations. By the authority vested in me by the Board of Directors of Arkansas Children's Hospital, we are pleased to invest Dr. Michael Schmitz as the recipient of the newly established Log a Load for Kids of Arkansas Endowed Chair in Congenital Heart Disorders. Congratulations, Dr. Schmitz.
I am truly honored to be the inaugural recipient of the newly endowed Log a Load Chair for Congenital Cardiac Disorders. And it means much to me that this chair is funded by loggers. I grew up in a farming community. Forestry is an agricultural enterprise that's similar to grain crops, but with a growing season of about 30 years instead of 1. My interest in congenital cardiac disease started when I was a medical student in San Francisco. My clerkship director asked me to go into an OR, see what was going on, and report back. The operating room belonged to Paul Ebert, a pediatric heart surgeon who is pushing the limits for early surgery in younger and smaller infants because he realized that delaying surgery often allowed for complications to develop. But he wasn't in the room yet. What I saw was an anesthesia resident quietly writing the anesthesia record next to a stainless steel operating table. On the table was a pile of ice bags about 2 feet high. A breathing circuit, some IV tubing, and a few wires ran into the pile of ice bags. There was a very slow heart rate on the monitor. I asked the anesthesiologist what was going on. She told me that they were cooling the baby in preparation for heart surgery. Then she pulled away the ice bag at the top of the bed to show me the top of the baby's head that was not much warmer than the ice bag. The baby's metabolism slowed, and the heart-lung machine would be used to low flows during the heart repair. This was the most awesome thing I had seen, and I knew I wanted to be part of it. I had many excellent mentors and role models during my training, but perhaps the most influential was Dr. Nicholson during my training in pediatric cardiothoracic anesthesia at the Children's Hospital of Philadelphia. Intelligent, decisive, and unflappable, Dr. Nicholson showed me how to use what I knew and discover what I didn't. This wasn't spoon-feeding education. It was about how to use your own wits. 20 years ago, I had to use those wits when I was the only pediatric cardiac anesthesiologist at ACH with a new cardiac surgeon. I had one fellow for help. The guy on the left is now a senior cardiac anesthesiologist with the University of North Carolina. Drug pumps for heart drugs needed during surgery came in a half a dozen types and were often lost under the surgical drapes. At the hardware store, I purchased pipe and clamps to construct a frame that allowed us to see all the medications that we were administering. In comparison, this year I work with 7 other pediatric cardiac anesthesiologists. Our equipment is state-of-the-art, and we often exceed the monitoring capabilities and technological skills of our contemporaries at other congenital heart centers. Nothing comes from the hardware store. We have grown from only providing anesthesia to cardiac patients having heart surgery to providing anesthesia to all cardiac patients who need anesthesia or sedation for any procedure at ACH. The advances in congenital heart disease treatment have been slow but steady. The advances appear dramatic in the historical context, even in the 20 years that I've been with the ACH Heart Center. The log-a-load chair helps us make such advances. Recently, we completed a study that determined the best dose of our most common infection-preventing antibiotic for cardiac surgery. Last year, we were alarmed that social media and a major university were suggesting that a material used for sterilizing surgical instruments might be made into COVID-19 masks. We collaborated with the University of Iowa to show that this material was not good for virus protection. Sometimes we encounter unusual complications that have never been described. We publish to increase awareness of the less common findings that could be missed. There's much to do this next year. Some of us have been using two-dimensional ultrasound to put catheters in veins and arteries for over 30 years. Ultrasound now has resolution fine enough to allow us to put catheters in vessels that are only 1/16 of an inch in diameter. We know how to use it, but we are developing a program to teach others. Heart programs monitor babies' oxygen levels at home with a machine that might overestimate oxygen levels in darker-skinned infants. We are investigating a new method of estimating oxygen levels that would not have this error. We are currently writing for the 4th edition of the leading international textbook for anesthesia for congenital heart disease, just as we have for all previous 3 editions. With the help of the log-a-load chair funds, we are able to professionally illustrate this version. And to ensure that we continue to encourage and train new pediatric cardiothoracic anesthesiologists, we are marketing our program with a video made possible with log-a-load chair funds. The log-a-load chair for congenital cardiac disorders allows us to extend our knowledge and discoveries so that we can more effectively improve medical care for those affected with congenital heart disease. Thank you so much for this honor.
Thank you again for being with us today. I'm Beverly Morrow, and I have the privilege of serving on the Arkansas Children's Foundation Board of Directors and as the chair of the Arkansas Children's Hospital Board of Directors. I want to extend my sincere congratulations to both Dr. Fontenot and Dr. Schmitz for being invested as endowed chairholders today. I'm honored to be part of your special day. With our focus on the future of children's health, we realize we cannot fulfill our mission without a strong foundation. Philanthropy allows us to continue our work and fulfill our mission to champion children by making them better today and healthier tomorrow. We remain grateful to Dr. Betty Lowe and family and Log-a-Load for Kids of Arkansas for making these endowed chairs possible. Thank you, and have a great rest of the day.